Hi, this is Eric Durek for MedHealth Fit, and welcome to our second module for GLP-1 training for the health and wellness profession. I'm excited. I wrote this edition of the GLP-1 manual um, about 3 months ago, and to say it had an effect on my professional career is really an understatement. It's really been kind of a whirlwind. But I'd like to get started on our second module right now, and this is called the Trainer's Guide to uh, GLP-1. So this is what I think trainers need to know when they're working with someone from this group in order to help them with their weight loss journey. So again, I'm going to have a disclaimer that this is an education video series. We're not in the practice of medicine here, which I think is a very good thing. We're in the practice of health and wellness, and any changes in medication status or nutrition status or things that you think may need to be done with these clients, it's a great opportunity for you to engage with other members of the healthcare community. So whether it's a biometric question, a behavioral question, questions about blood labs, questions about their exercise program, how they're feeling, you need to engage with other healthcare people. So that's the disclaimer. We're not making any claims here. We don't really need to because we know the power of exercise. So let's look at our agenda here. I want to talk about emotional IQ. This is something that's been brought to my attention here with my coaches and the people that I'm working with. We want to talk a little bit about nutrition. It's the basics of nutrition. We've had an entire module relating to nutrition and strength training. And lastly, we want to dive in a little bit here about the relationships regarding the trainer and the healthcare profession, and just relationships with these new clients who are coming into the health club setting. All right, so the more people who are taking GLP-1 medications, as they begin to exercise, trainers are going to need to know the basics. They're going to need to know the basics of these medications, how these medications work in general, and then how these medications actually work when a person engages in exercise, and then what type of exercise. It's going to be a very fascinating journey, but I think over time we're going to start to see some pretty interesting similarities as to how well the program is working. So let's define what emotional IQ is. And this is something that I think has not been high on my radar, but it's been one of those things that is becoming more and more important in the health and wellness field as we have more issues of depression, suicide, people who are closed down in their homes during COVID. So IQ is a patient-centered approach as opposed to a program-centered approach. I don't want trainers to get into the mindset that I've got this perfect program for weight loss with people who are taking GLP-1s, because you know what? There is no perfect program, because if there were, someone would have done it 30, 40 years ago. This emotional IQ will also improve the quality of life of people who are in your programs, and it'll help them work through behavioral issues that they may not be able to get with other types of coaches. The most important thing here is to develop a safe and nurturing environment. It's not a daycare center, it's a health club. But the people who are coming to exercise here are not athletes, and they have other types of issues that they want to work on. And behaviorally, they may not be 100% in the mindset of, well, I've got to really exercise hard and harder because I'm going to go to the Olympics or the NCAAs. No, they're trying to work in a place where they're going to feel comfortable, in a place where you would like to get to work with them, because you're a part of their weight loss solution. And it's not just the program that you're administering to them, it's the personality and the person and the behaviors that you're working on with them. They're going to be very helpful. So one of my favorite movies is City Slickers, and we'll talk about that here. So this IQ talks about support. It's about patient phone calls. It's about taking good notes on training. It's about discussing some of the issues with not just your client, but maybe their family members, maybe their physician. In terms of their quality of life, you want to change the exercise environment to something that they feel very comfortable in coming back and repeating the program. And if you have something that you want them to change in the home environment, you want to strive for that one small thing. And if you remember the movie City Slickers, he said, "What's the meaning of life?" And he said, "It's that one thing, and you've got to figure it out." Well, as the coach, you need to figure out that one thing as well. Of course, you're not going to do it with a cigarette in your mouth, but that's part of the movie. Some of the issues, I can't do attitude versus let's do this together attitude. It may not be good enough, but you know what? We're going to get better every day. Okay. So our goals and objectives are not to create a super athlete, is to create a person who loves the exercise process. The environment, it's not just a gym. It's a place where they can sit and talk. It's a place where maybe they can do a hydro massage. It's a place that maybe they can walk around the track or walk outside. It's a place that they're going to feel really comfortable in. If there's a little juice bar there, they can sit and talk. They may want to discuss some things with their colleagues, their brothers and sisters in arms who are going through this program with them. And we want to make sure that there's this coaching approach, this training approach to GLP weight loss is a little bit different than what we're normally used to dealing with youth athletes or people who are just on a regular program or seniors who are actually interested in just having stronger bones. We want to have a little portion of all of those things. So nutrition becomes very important for GLP-1 because these people are not eating food. So one of the questions that I would ask if someone came to my program in day one is, what are you eating now? What do you have for breakfast, lunch, or dinner? Do you even eat breakfast, lunch, or dinner? How much water are you taking in during the day? What supplements are you taking right now? Has your doctor or your dietitian recommended anything? Um, you know, are you taking maybe a protein powder or a protein supplement or amino acid, branch chain, or something of that nature that may have been recommended to you? Because that's going to be important as you move forward in the exercise process. Um, what types of foods have been recommended by your dietitian? And what kind of foods can be tolerated by your new clients? So how can the trainers help? They can help by talking about total calories. If a person's had a certain amount of foods during the day, but they don't know what the calories are, you can help them count the calories using an app or just some charts that you may have in working with them. You may want to recommend a certain amount of fitness technology for them. The new Apple Watch. I just did a podcast with Mo Iqbal and Matthew Janusek on the new types of technologies that are coming out for the fitness industry, and it's fantastic. If people want to use it, I think there's going to be some real benefits to that. And the last thing is following their progress, and they are going to make progress. And you want to make sure that you're following it, you're recording it, and you're being very supportive of that process. So the history of medical weight loss in this country is pretty interesting. We talked a little bit in our first module about fen-phen, but also one of the things that's been pretty big in the medical industry is bariatric surgeries and very low calorie diet regimes. But we also have some companies that are in the mix right now in terms of GLP-1. The first one is Weight Watchers. They are moving right along in terms of working with lots of weight loss clinics in the United States. And I think that opens up a very big possibility for the health and fitness industry because we'll be able to work with some spillover people who are in the Jenny Craig and the Weight Watcher programs because they're probably going to want to work with specific clubs as well. Also, Noon, all of these programs, I think, are going to be looking at the exercise. So what makes these programs so unsuccessful? I don't necessarily know that they're unsuccessful per se, but they're really concentrating on the nutrition and the lifestyle components, not so much the body composition. So like GLP-1, if you're losing a lot of weight on Weight Watchers, you're eating, a certain amount of foods, you may be losing lean tissue, but you don't even know it. Okay. So can trainers do better now? Well, I think they have other tools in their toolbox that can be used for people on GLP-1. And I think that they're going to be a fantastic augment to these national programs. So area one, let's build a community. All right. We talked about the behavioral model for your clients. It's a patient-centric model. It's something that more physicians are looking at in terms of exercise and chronic care programs over the last 20 years, because there are a lot of basic medical programs have not really been successful because they didn't have the patient-centric helping the patient along, not just prescribing a medication, but really working with them in terms of how these programs are going to be successful for them chronically. And again, this is where exercise plays such a big role. Area number two is developing a best-in-class exercise program. Now, I said in the previous module that there is no best overall strength program that can be used for everyone. They're going to be very individualized. But progression is based on the prescription dose of GLP-1. That may be a very limiting factor on how much intensity a person can increase with their strength training. The person's initial exercise experience, their age, their initial weight, the type of strength training program used, whether you're using body weight or rubber tubing or circuit training or high intensity training, which I wouldn't recommend at the beginning. Okay. But there are people who do a version of high intensity interval type program where they do a stop and start and a stop and start. And what they do is they do the variations on the work to rest ratio. We'll talk about that in our exercise module. And then whatever type of basic training program that that you can develop for patients, especially in phase one, as I let the train go by here, you're going to develop a basic training program for them in phase one, which could be 2 weeks, 3 weeks, 4 weeks. So they're getting to be very comfortable in the gym. They're getting comfortable in using some of the strength machines. They can use them on their own. And recovery here is paramount. All right. Let me go back to training is based on calories. So if a person comes into a strength training program, any type of exercise program, and they haven't eaten in a day and a half, any trainer is going to have an issue with trying to get them to do any type of intensity whatsoever. It really is based on the total calories, which is why you should ask them what they've eaten in the past 24 hours. So now we'll come down to recovery, which is paramount. After each set, after each rep, and even after training days, you have to have a value on how sore patients are, how fatigued patients are, how many other issues that they may have. They may be mentally exhausted and because they don't feel like they're getting the right type of recovery program. So you're going to increase weights based on changes in body composition, based on their nutrition, and based on their ability to increase weights. I know that sounds like a sort of a misnomer here, but their ability to increase the weight in any given program is going to be based on this amount of bucket of information that you have on them every time they come into a strength training program. So area three is consistency. And I got to tell you, in the aging process, almost all of the literature and articles that I've read is that if you can be consistent in your exercise, you're going to see both improvements and you're going to see the body, the mind, and the spirit at a much higher level than if you exercise and then take time off and it's very inconsistent. So you need to develop a regular training program, schedule each time each week with your trainer, either at the club or at home. You can use Zoom, like what I'm working with this group right here now, and have a self-paced program that they can do every day. And it may be just walking or stretching or doing breathing exercises on a regular basis that you've programmed for them that they can do on their own, and you can actually have that as part of the checklist when they come back into the club or they come back and train with you in person. And this is all part of accountability, okay? They need to be accountable for their programming, for their nutrition, for their hydration, for their administering of the GLP-1 and you need to be accountable as the trainer to make sure that you are following this patient-centered module, this training methodology, and that you're also accountable to yourself based on the all of the information and data that you're writing down upon them or for them, which you can actually translate to physicians and other healthcare professionals down the road. So accountability here is going to go both ways. And I think that in the manual, I really talk about how the trainers can do certain types of things, and the more comfortable that they feel with using technology, using outcomes apps, even writing down information on their clients, I think that it's going to be very beneficial for both parties. So I did mention in my last module about Ann Gilbert, AnnGilbert.net. She brings 30 years of experience in two very unique and successful programs. And what she does off the bat here is she has people in the pool and she does the programming in small groups. And then after they achieve certain metrics, she moves them to land-based exercise. And some of them will do group exercise programs. Some of them will move into personal training. But I think that her approach of having the pool exercises, because it's a calming environment, it's something that everyone can do. No one's going to, fall or have any injuries per se in the pool. And I think they're going to build a camaraderie. I give Anne so much credit for the work that she's done in this area. And clearly the industry recognizes this as well, because she speaks at all of the national conferences on these programs. So I'm going to give a plug to Ann Gilbert. Thank you, Ann, for delivering such a great program. It's going to have wonders here for the GLP programs. So another group that I've worked with in my career is Ultimate Performance Company in Los Angeles, California, and they use high intensity strength training for their clients. And they use it for all of their clients. And I got to tell you, their program is very intense. When they started Ultimate Performance, they started it as a training program for athletes, hence the high intensity, 120-pound dumbbells, et cetera, et cetera. But they kept getting more and more of their clients who wanted to be on weight loss programs, and we can see by a couple of the pictures that we have here, they do a lot of pre and post photographs, but they also do extensive body composition. And part of my work with them was, as you can see by the reports on the bottom, is that we actually looked at body fat changes in their some of their clients as they were going through these programs. They're getting more and more GLP-1 clients, and I'm hoping that we'll be able to continue to do some of the work that we're done in terms of looking at regular body composition with their people, as I want to do with other groups as well. I think that the body composition over time is going to be one of the strongest areas of assessments that the health and fitness community can perform for GLP patients. And one of my long-term colleagues is a gentleman named Keith Spenowin from Minnesota, and his Revive Medical Fitness Center is one of the nation's oldest running medical fitness facilities. I think it's coming up on 40 years. And Keith has been working with GLP-1 patients in individual training for about a year and a half now. So I'm going to put him in the category of people who have been working in the field on this for a while, and we're going to be looking at some of his data as well. So he uses a comprehensive program. He does all aspects of assessments, with exercise and recovery, nutrition, body composition, behavioral health. He's one of the models for land-based training that I think a lot of clubs may want to look at in the future, because he does it very, very well. He's been at it a long time. It's a family-run business. I give him such credit because he's done so good for so long, but now he gets to start in working with GLP-1 patients. So he's got to sort of revamp his work efforts as well. So one of the last clubs that I want to talk about is the Monarch Medical Health Clubs, also in Los Angeles, California. And they have physical therapy, and they have other types of modalities that they use, like cryotherapy and cold plunge and some of the precision wellness aspects. But because they're run by Dr. Ryan Green, who's here in the middle, who is a physician, they actually use blood labs for their clientele at the beginning of their program and at regular intervals. They've been working with GLP-1 patients for about 2 years now, and we're going to be looking at their data starting in the fall. And there's not a lot of people, but I think what the information that we're going to glean from these early entrance clubs into the market is going to be something that I think the industry will really benefit from in the future. So Dr. Green is the expert at the blood labs and how the training is affecting not just the body composition, but also what it's doing to lipids and C-reactive protein, insulin, other hormones, etc. So again, hats off to yet another great program that is started in the industry and something that I think is going to be a model for other clubs to be looking at. So the information's out there. We just need to get it to you. That's my job. So let's look at our trainer's checklist. Number one, work with referring physician, have a script pad. AC Fitness in Virginia has a wonderful prep program pad that you can go to acac.com and you can download that. You can make one on your own. Got to have a script pad, very important. Contraindications, doctor's notes, etc. Number two, full body assessment, including body composition. And if you have the opportunity to have your clients get blood work right now, they can do that. On my website, you can go to medhealthfit.com and click on the blood labs, and your clients can actually get blood labs online from a website called requestatest.com. And they're way less expensive. They're still insurance reimbursed, and you can get specific types of labs for your clients. Checklist number three, one-on-one or small group exercise classes for GLP-1 patients. Should they be on their own? Well, I don't know. You may want to have small group programs for GLP-1, but they'll be integrated into the health club. And I think that's a wonderful thing. Trainers are going to have to understand the types and the dosages of GLP. Just like insulin, you have to understand when that dose needs to be changed and speak about it with the doctors. As a person becomes more fit, their body's going to utilize the medication better, and you may actually have bouts of hypoglycemia. So you don't have you're not changing the dosage yourself. That's what the doctors do. But you have to be able to see how your clients, as they become more fit, are reacting to some of these things. And most physicians will actually scale back the medication after about 10 weeks or so anyway. I listened to a podcast 2 weeks ago from Jim Laval from Lifetime, and they actually have, which I'll talk about at one of my slides here later on, they actually talk about how they scale back on their medications. And I think that a lot of doctors will sort of follow suit on that. Regular body composition assessments. The body water is so important. Next checklist is strength training, progressive program based on their weight, their exercise history, the amount of medication they're taking, and the food and water that they ingest each day. They have to have water and electrolytes to sip during and after their session. And you need to reassess at 10, 20, and 30 weeks at a minimum. So here we are at the end of our second module. I appreciate your time. You can log on to my website, go to the GLP-1 page, and you'll see that SurveyMonkey link. And you can either take the number 2 exam module exam, which is only 5 or 6 questions, or you can choose to take the big exam, which is 40 or 45 questions. And when you're done, email me, let me know. And we want to make sure that after you've read the manual and you've done the modules, that you feel very comfortable. And we will be engaging in a weekly, at least once a week, starting in September, live modules with this information. So I appreciate your time in our second module. And if you have any questions, you can email me at directfitness@gmail.com. And if you've got any questions about how the modules go, and I'd love your impressions about how the book was written. I'm always looking for feedback. And I think that there's going to be some really wonderful communications that's going to come from this. So anyway, I appreciate your time. And if you have any questions, you can get a hold of me. This is Eric Durack for medhealthfit.com. And I look forward to hearing from you soon. Thanks a lot.